I got interested in studying exercise and well-being because I went through an experience my final year of college. I was a dance major and I broke my foot. And I went from exercising or dancing 2 to 4 hours a day to nothing. And I got really depressed. I had a friend who was a strength coach and he convinced me to go to the gym twice a week with him. And so I brought my boot on my foot to the gym. And I noticed that I felt so much better on the days that I exercised than the days that I didn't. So I thought, there's something to this. And that kind of launched a whole career in studying exercise and well-being, but also that was the motivation to helping other people engage in exercise as well. Exercise can improve mood. Exercise can improve feelings of well-being, kind of reducing the threshold to frustration. So things that would normally drive you nuts and you would get really frustrated and aggravated about, if you've exercised that morning, say, maybe it causes a little blip in your frustration, but then you can carry on with your day without holding that with you. Now, if we talk about mental illness, there's a couple of things here. Exercise can reduce symptoms of depression. It's an effective treatment of depression, but it's only mild to moderate. But in the more mild cases, exercise actually works as well as antidepressant medications. In terms of anxiety, we know that exercise can help with symptoms of anxiety for some people, but it's not quite as effective as the antidepressant medications, or really talk therapy is where it's at. So exercise helps anxiety. Exercise definitely can help with treatment and prevention of depression. One of the really cool things about exercise is when it comes to panic disorders, because exercise can be used as like an exposure therapy to panic disorders, because physiologically, the same physiological sensations of when you're exercising, increased heart rate, increased breathing rate, start sweating, that's the same thing that happens in a panic attack. So with medical supervision and all those things, it can help increase the threshold for somebody with panic disorders. A lot of this stems back to, does a person like to exercise? Did the person have good experiences in childhood, or was exercise used as a punishment? Those feelings and emotions from once upon a time can translate into adulthood in the way a person feels about exercise then. So there's this individuality about whether exercise will have these benefits. Every human is different. So the best advice is do something you love. And if you don't know what you love, try a whole bunch of things. And college is the best place to do that because it's already included in your tuition. There's no $200 fee to try something out for a month. The recommendations for general health benefits is 150 minutes of aerobic activity and strength training at least twice a week, right? That's for the general health benefits. But when it comes to mood and mental health and mental well-being, it's what works for you. For some people, 150 minutes is out of the question. I will not be running for 30 minutes at a nice tempo because it's too hard, and that's okay. So 10 minutes might be all that person needs to improve the mood and make them feel better for several hours, the rest of the day, whatever it may be. There's a lot of research on aerobic training. So that's your walking, jogging, cycling, swimming, that kind of activity, and how that affects the brain and mood and well-being. We also know that aerobic activity, or activity in general, affects the brain in the way it can focus, pay attention, set up people for learning. When classes get tough and there's too much going on and the classes are too hard to focus and I don't want to do my homework, then the best thing to do is go for a walk, go for a jog, or whatever your preferred mode of activity is. So it goes back to the person's preference. Do you like to do yoga? Do you like to do Tai Chi? Do you like to do dancing? Whatever the preference is, do that, and that will set your brain up for success in academics, for success in emotion regulation, how you process things that are happening. Remember that threshold to frustration increases. So when you find the thing that you like, you'll be more motivated to do it, you'll feel better doing it, and you might have some other benefits as well.